Ladies and gentlemen, welcome back to Coach's Corner. I'm Jeffrey David Hartford, your host and the coach, the conduit of optimism, altruism, consciousness, and health. And today I have with us the author of Against Medical Advice, Simone Gisondi. Simone, thanks so much for being here. Welcome.
Thank you so much, Jeffrey. It's a pleasure to be here and an honor so we could talk about all things health.
Absolutely, absolutely. I'm really looking forward to this. Once I picked your book up, I could not put it down, and we don't have to talk about just the book, but I would love to delve into that a little bit. I've got some questions about it. But before we get into that, I will share with the audience, Simone is a certified holistic nutrition consultant, a regenerative detox specialist, holistic cancer practitioner, and I even noticed you're a certified hypnotist. I love that.
Yes.
Let's dig in. So each of those things, are those things that you're doing on a regular daily basis, or these are, parts of your tool belt that you can pull from as you work?
Yeah, so all of those modalities are in my arsenal. And whenever I work with my patients, my clients, however you want to refer to them, I kind of pick what would be the most appropriate course of action vis-a-vis what they present with. So a lot of times, if I could give a generalized sort of cover all statement, most people, when you look at it foundationally, it's all about mindset and it's all about trauma, unresolved issues, emotional most of the time, even from a nutritional perspective. So yeah, so I use, especially because once you get to know your patients or your clients, you get to see how open they are to what you can actually use with them. And I'm sure that that's the case for you. You have to be able to get to know them, establish the relationship, and then approach it in a way that's actually the most conducive to the most positive outcomes for them.
Absolutely. Yeah, I'm with you for sure. I like to say it's important to meet them where they are,
Absolutely.
discover what their goals are, what it is they're looking to accomplish. My primary day to day right now is that in my massage practice in my clinic. But I have a background in personal training, corrective exercise, strength and conditioning, functional nutrition coach. So there's, similar dynamic of different tools in the belts to pull from that, based on where they're at and what their goals are. That's exactly what I do. So I'm curious in reading your book. So we'll kind of jump right out. I know it's been out a couple of years, so this isn't like I'm giving it away to people, but you experienced a stroke, and I'm just absolutely blown away by how, talk about mindset, the strength, the mental fortitude, the just human capacity to push through the number of days that you did because you were unaware that it was a stroke. I mean, I'm just totally shocked. I don't recall exactly. Was it like a Thursday to Tuesday or something like that? Was that
Mm-hmm.
stretch of time? That's just mind blowing to me. And then Tuesday you collapsed, you get rushed to the ER, and you have your experience at the hospital, which I'm curious, was it that individual experience that pushed you into the direction of holistic everything, or were you already in that position previously?
So prior to the stroke, I was already very invested in a healthy lifestyle, but it was more in the unconscious, unaware stage, I would say. So I was a personal trainer. I got my certification as a personal trainer in 2007. So I was working out, I was doing fitness competitions. I was very regimented with my diet. I was counting my calories, and all of my macros were, allocated to exactly what my intended outcomes were. I was looking to make sure that I do my PR, so my squats, my deadlifts, everything was sort of, I was tracking everything. I was very methodical. And of course, when you look at that as the blueprint of health, and then you end up in the hospital, fighting for your life, of course, it's going to make you wonder, like, was I doing all that for nothing? So yes, I was actually already invested in health, but the holistic aspect of it came after that because of what I experienced when I was in the hospital. So for everybody who's listening, what was really upsetting for me was that they used the protocol that they used on me. So I was, at the time when I had the stroke, was, and I hesitate putting I next to stroke. So when the stroke happened, let's call it that, I was 35, so I was very young. I didn't check any of the boxes because typically people that end up with strokes have cardiovascular disease, they have atherosclerosis, they are hypertensive, typically overweight, older. So I didn't check any of those boxes. I was actually young, athletic. For the most part, I was carrying a six pack throughout because I was so regimented with my macros. I was a runner. So there was absolutely no chance that I could have had heart disease, given the fact that I had the lifestyle that I had. And of course, I was at a very healthy weight. My medical doctor used to say that my blood test results were exemplary. That was the word that she used to always say, that I'm her most exemplary patient. So it was really hard to believe that I actually suffered the stroke. But then the way that they approached it in the hospital, the protocol they used was that they use on everybody who presents with a stroke. So all of the medications they gave me, even though they did a battery of tests, so they did the Doppler, like everything when I was in the hospital, and none of them came out. And to this day, doctors have not told me what exactly it was that caused the stroke. They kind of chalked it up to stress. So to this day, I do believe that stress, unresolved issues, things of that nature are the foundation of all of these horrible things. So they actually put me on the protocol that they would have put a, let's say, 69-year-old hypertensive overweight individual, whether it was a woman or a man. So I used to get the medications, the blood thinners. They put me on Coumadin. For those of you that are well versed with pharmaceuticals, they put me on Coumadin. They put me on what they call the baby aspirin. So I believe it's an 81 milligram aspirin that I was supposed to take for the rest of my life. They told me that if I don't, I'm going to for sure have another stroke. And that really pissed me off. It really angered me, because I could feel, obviously, for those of us that are self-aware enough, I could feel that I was not getting better. In fact, I was getting worse. I was feeling increasingly worse. So I said, okay, these people clearly do not know what they're doing. And to make matters worse, nobody was even asking me, are you okay? How are you feeling? Is there anything that you would like? Or nothing of the sort. So it really upset me. So that's what put me on the path to kind of looking for the answers for myself. And I know that you practice this too. I highly suggest to everybody to go and work with people that can actually provide you with an individual protocol that is actually conducive to a good outcome for you as the unique biochemical individual that you are.
Absolutely. Yeah, I've been saying to pretty much everybody I talked to lately, certainly on here, that I see it as a paradigm shift.
Mm-hmm.
Allopathic medicine is within and arguably leading the disempowerment paradigm. It's
Absolutely.
there's such an indoctrination rather than education into the medical side of it, the schooling side of it, whether it's for the doctors, the nurses, the phlebotomists, you name it, anybody that's been through that training. It is
Mm-hmm.
geared towards so much overwhelm with information that they can't even have an intuitive side of it. They can't truly practice what they were taught. They feel so much pressure, and they're not looking at another human being when they're treating them. They're just looking at, in their mind, they're thinking back to the information that they were bombarded with, and it's symptom, 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 label it this, and then pop, it's pills, injection, surgery is
That's
the
right.
protocol. And as you said, it doesn't matter who's standing in front of me. If the diagnosis is this, then this is the treatment. And man, if we just look at the statistics, it's not working. Even if there is a future in which some degree of allopathic pharmaceuticals need to stick around and make sense, we clearly have to modify dramatically. And we have to stop making people so fearful. So, it's all about these low vibrational energetic
Oh,
frequencies that we're pushing people down to. And in that state, they're terrified. There's anxiety, anger, fear, all of those things. And I'm with him. There's a side of me that gets upset by it, and I'm very sensitive to your personal experience when you were in there and feeling helpless and hopeless, laying in the bed, in triage out in the hallway for numerous nights. You didn't even have your own room, and these bright lights beaming down on you, and lights flashing and sounds beeping and people walking past like you don't even exist there. I mean, that's just nothing about that is health. So the shift that we have, we're going into more of what I'm calling the empowerment paradigm. And
mm-hmm.
what a distinct difference. There's so many of us, whatever role we play, we get to have conversations like this and share information with people who have woken up to this shift, and they want the information. We're giving it to them right now for nothing, and just saying, hey, you just got to do your due diligence. Listen to the conversation. Do not just take our word for it. Here are some sources. Let's get that information out to people. So, there's an aspect of it that I'm really grateful to be a part of, and I'm really happy for our conversation. And I will also say, you mentioned mindset is playing a big role, and I think that's a little bit of a segue into something I'm really curious about with you. That you were born and raised until 12 in communist Romania, correct?
Yes,
That has to play a role. What you were raised around, if we pull from some of Dr. Bruce Lipton's work, the subconscious programming, you were
that's right.
programmed for survival. And we don't really, if we're just on the side of survival, if we're just in our sympathetic nervous system, all we do is survive. We aren't optimizing. And you, with the training protocol, how regimented you were, it mattered to you how you looked, and I can totally appreciate that. But a lot of that seemed like you were putting on this coat of armor, at least from an outsider's perspective, that in many ways, the stroke, as crazy as this may sound, was a blessing, and it opened doors to you to step into this other side of embracing the optimization side. And there was still a little bit of a disconnect because 35, now you're living in the States, right? At that time, were you already in Florida?
No, so that was in Canada, and the way that it unfolded was clearly at a very stressful period of time. But you're so right that, I mean, obviously, after the fact, I went so deep in all aspects, and there are so many nuances and layers in health that I think people overlook because, of course, the system has programmed us to believe that everything is physiologic and we have to just look at what the body does. But people should know that our thoughts and, of course, the programs, much like what you said, are actually triggering and signaling the brain to give certain instructions, and the cells take those instructions, and those thoughts actually go as deep as changing the pH in the body, which clearly then triggers the cells to go towards something that's more for balance, for healing, versus for acidity in the body, which will clearly damage tissues, which will prevent detoxification. And those acids then create damage in the cells, create damage in the tissues. And then you have a cascade of illness and disease. And then you have the allopathic medical community that will say, well, so let's give you another pharmaceutical, which is also acidifying and also, a detriment to health to address that. So basically, they look at one fraction of the entire picture and address that and try to make you believe that that is the be all end all to healing. It's not, because we are not just a body. If that was the case, then that would throw out the entire mental health community. Like, why would we go and give anybody pharmaceuticals over the fact that they're depressed? Show me depression in physical form. Therefore, that alone is going to show us that there is a component of us in our health that is intangible. And that is where all of our power is. And that is what will actually help us heal. So to ignore part of it is to ignore the most important part of it. As we say, and as it's been said, you are as strong as your weakest link. So if you have a component that's left unaddressed, and that is actually the number one component that I worked on the most, even when I was in the hospital and when I came out. And that was, first of all, I went on hunting for information. So I kind of ignored the idea that, I was feeling this physically or I was feeling that physically. I said, I want to know so that I could at least get over that being pissed off at the community for the fact that they made me feel. I said, I really want to calm down. So if I can calm down, then we could deal with this. So that was the number one thing that I wanted to address, being able to put my mind at ease so that I'm not in that hypervigilant state. And I highly recommend that anybody who's going to undertake any kind of healing journey, they look at that. And I work with one of my patients, and during one of our conversations and during one of our appointments, she confessed to me that she had eaten about a kilogram of almond covered with chocolate. So I asked her, I said, well, what led to you wanting to do this? Let's talk about that. Why wouldn't you eat things that are more? And she said that she wanted to feel better. And when we went through the conversation, she was saying that when she was younger, her mom used to give her sugar to make her feel better. So she was seeking that comfort that sugar gave her because her mind made that connection between sugar and comfort. And a lot of people are in that boat because when we are young, parents give us treats, or we have our extended family members who give us chocolates. It's all done with good intentions. However, it's not necessarily conducive to a positive outcome. And if you were to go even deeper on that, back in the day, things were much cleaner than they are now. Skittles with lots of colors on them and M's and all of that good stuff. So I actually went down that path, and I now recognize that even in my work with my patients, I have to always address the emotional and the mental. Like, why did you feel that you needed that? And when you talk to people about the feelings, they feel heard, they feel seen, because it's not just about what's happening in the body, but like, how do you feel? And they constantly struggle with being heard and seen because people in their families don't hear them. Nobody wants to hear what they have to say. Nobody cares about the way they feel. And that's such a huge component because that's what was the whole thing. And I remember even when I was in the hospital, one of the doctors that treated me, so she was a neurologist, not a neurosurgeon, but a neurologist. And she was so lovely because she was the only one that would spend time to talk to me, just talk. And that is what stands out the most. And that is the one positive thing that stands out the most. Everything else was just medical people that were coming to give me injections and pills and check on my vitals and change the bags of the things that they were putting in my body via IV. So it was just a flurry of everything that matters the least. And the one thing that matters the most is missing from that community. And of course, I worked in the medical field. It was actually such an important aspect because I worked in the medical field, except that it was not patient facing. So I was on the business side of it at the time. And I was very privy to all of the strategies that went into what programs got what funding and what were the parameters and what were the criteria of why people would actually get access to these programs. And then when the cuts would happen, because as you know, governments and pharmaceutical industries and insurance companies, what they do is they cut from programs so that they could keep more of the money. They would just look at these kind of parameters. They never cared about how people felt. It was basically, how does it get down to what can we take away so that we can keep more of the money? It's all about the money. So I highly recommend, and I say this to my patients too, do not ever put, even in my own hands, don't put your health, don't put your life in the hands of a stranger who has no vested interest in the outcome for you. Look for people who could actually guide you, connect to yourself so that you could have a feeling about it. And as an aside, I also say that if I was to be able to do this all over again, I would take the stroke because it really unlocked my intuition. I mean, I went from what I would say 2% to 98, 99% intuition after the stroke. And I would do it all over again to be able to get that gift. So connect to yourself and feel and take the cues that you get from the essence of your being as well as your body.
I really think that feeds into the premise of this paradigm shift and how many of us that are on this side of really wanting to empower people, we started by empowering ourselves. And my situation is a little bit different, but I will share with you, as I've shared with many guests and my listeners, that back in June of this year, I received a diagnosis of a rather large tumor on my left kidney. The diagnosis came about by some blood in my urine, but no pain, no issues. We did a CT scan of it. That's where the diagnosis came from. And their concern was that it could have traveled, if it were to be cancerous and move, it could have gone to the lungs. So we did a scan of the lungs. The lungs were crystal clear. And we've since done a couple of different scans. We did a follow-up CT scan a couple months after, and then most recently did an MRI. Thus far, it's showed no change. It hasn't gotten any larger, but it hasn't shrunk yet either. But upon my diagnosis, I have already done years of some introspective work, meditation, really reflecting and getting to know myself. And I really think that is, and you were touching upon this already, but that's the root of us healing, is getting back to our true selves. Some aspects can be through nature, but it's all about closing our eyes and turning within. Our whole system, this whole paradigm is geared towards trying to find answers. We've been programmed to believe that all the answers we seek are outside of us, and you have to
Yes.
look for the experts and defer to the experts. And if you speak out of turn, you're not an expert. Who are you? Why am I even listening to you? You know, and it's we all, especially based on if we're talking about our individual selves. I truly believe we all came here with some level of intuitive sense of what it is we need to do. I mean, you think about animals and children without the proper guidance, there's certain aspects of us as human beings that we just innately know what it is we need to do, but that
Hmm.
gets programmed out of us because the system wants to be able to, as you alluded to with your job there and the business side of it, it's about profit. And it's about, every time I hear people talking about some level of government program to provide us health care, because that's a human right. We all need health care. And I don't disagree, but they're not running it properly. So we don't have health care. We have sick care. We're not getting any healthier if we're in the system. We get healthier when we remove ourselves from that system and get back into connection with nature and with our truest form. So I think for those of us in our shoes, my diagnosis, I feel, was a blessing. And in the moment of receiving it, I even felt that. I looked at my urologist and I told him, I said, Doc, I'm not going to be your average patient. I know this is going to sound a little crazy, but as I received that diagnosis, I felt a tangible rush of energy from my feet all through my body up to my head. And it culminated in a big smile on my face. And he's like, he's looking at my chart, looking at me, sees that I'm in shape. We're the same age, both have shaved heads. He says we got the same barber. And he goes, Jeffrey, I don't know why you have this. And I said, Doc, I think I do. And I know it's going to sound crazy, but I'm going to say it anyway. He said, I believe I manifested it because for years now I've been studying how people heal themselves. In allopathic medicine, we hear this phrase spontaneous remission, as if to say it's just a miracle. We have no idea what it was. We didn't do it. We didn't give medication. And we can't give it a more tangible name because we can't give you credit for having played a role in your body healing. This needs to be something magical and something disconnected. So this is spontaneous remission. But boy, there's an awful lot of spontaneous remissions of things ranging from very simple and basic to stage 4 cancers. These people were on their deathbeds and they came back and they no longer have any sign of cancer in their body. Their body healed itself.
That's right.
We know that can happen. For years as a massage therapist, personal trainer, functional nutrition coach, whatever labels that I have with my education, none of it was credible enough in our current system to be listened to by people that, God forbid, they or a loved one was diagnosed. But as we go through it ourselves, we experience something ourselves and we overcome it, especially without getting the system to help us, because I knew instantly he wanted to remove it surgically. I said,
Of
Doc, that's
course.
not what we're doing. It's not what I
Of
want.
course.
I said, I'm not going through standard of care treatment. And the last time I was in with him, I actually asked him this question. I knew what his answer was going to be, but I had to know that I asked it and give him an opportunity to say it. I said, Doc, in your experience, has anybody recovered from this non-surgically? Has their body repaired it at all? And man, the look on his face, that big, thick, furrowed brow, and he looked like I just kicked his dog. He goes, absolutely not. That's ridiculous. I said, all right, thanks. Appreciate it. And interestingly, a few days after that, I heard from a friend from back home that his wife, he was actually letting me know he heard from my older brother that about my diagnosis and they were thinking of me and sending their thoughts and prayers. But he also informed me that his wife had the same diagnosis. And similarly, she did not go standard of care and hers is dramatically shrinking. And I just felt like I was gifted with that as well.
Of
Not only do I
course.
already know about it because I've read about it, but now I know about it firsthand from somebody in my own little circle that is going through the same exact thing. So this is all just part of this shift of the paradigm getting into empowerment. And we're both playing our role and being able to share our stories with people and provide them with the information necessary to heal themselves. So I guess that's just a long story. I'm not really asking you a whole lot of questions right now, but I guess where we'll go is since you've begun your practice and after your own personal journey healing, Have you seen anything to that extreme of somebody going through something similar to what we've done and healing themselves?
Oh, absolutely. And thank you for sharing that because it's such a reminder. And I truly believe that we're here to be able to be the proof that people want to see that this is actually indeed possible. When I tell people that I am the one who took ownership of everything related to what I suffered with regards to the stroke. And of course, the stroke was the stroke, but then there was additional damage done after the stroke with the medications and all of that. So I had to undo all of that. And speaking of cancer, so the reason why I studied cancer, my dad actually had cancer. So I say had cancer because he doesn't have it any longer, but he's still alive. A lot of times when I say to people, my dad had cancer, they say, oh, I'm so sorry because they think he died. He didn't. He's still alive. And the same thing. I mean, the doctors wouldn't even consider the idea that the possibility even exists of you healing yourself from anything yourself by yourself without the medical industry or the medical community having a hand in it. And the reason why my dad had cancer twice, I'm not here to try to coerce anybody because I'm a huge believer in choice. It's just a matter of us educating everybody and everybody making their own decisions with the information at hand. Please do your research if you need to substantiate anything. But so my dad had his primary cancer. And I think it's also worth noting that there are many emotional aspects of it. So my dad's first cancer was lung cancer. And physiologically speaking, he was a smoker, of course, as is the case with every European man who smoking was part of the culture and every man smoked. However, if you look at some of the energies that are sort of embedded in the tissues, and when I studied iridology, that's another thing I studied, and I studied holistic iridology with a great doctor that I respect so much. A lot of the energies of emotions are actually in our nervous system and in our tissues. The lungs have a lot to do with grief. And knowing my father's childhood and history the way I do, I could very easily see why that manifested in the way that it did for him. Of course, especially given the fact that those were all unresolved. I mean, of course, the old way of doing things in Europe, men are not supposed to show any emotion. You're supposed to be very stoic. You kind of keep everything in. So that was my dad's approach, of course. And then, of course, yeah, that manifested. And I remember when I told him, I mean, he trusted doctors implicitly. And I told him, Dad, do not do the surgery. But of course, he did not listen to me because he was so bought into the fact that doctors are the ones that heal us. And the medical community is where you go when you get sick. And especially when cancer is seen as the be all end all of the worst of the worst. So he went to the doctors and they did everything that I would have advised them not to do. So biopsies, radiation. I mean, just to talk about radiation, I remember my dad, who had been a meat eater, of course, old European, was after they did the radiation, he said that he could taste burnt flesh in his mouth and he had that feeling and the smell and the taste of it for months after that he couldn't even eat. So just as an aside, that a lot of the after effects of the modalities that they use for people to heal them have long lasting effects and consequences. So despite my pleas, yeah, my dad went and did the surgical procedure. So they removed, I believe, his entire or about 80 to 90% of his lung where the tumor was. And then, so now, of course, he doesn't have a lung, which has decreased his capacity. So it all kind of builds on top of each other because when cancer does not exist or cannot exist, and this was obviously scientifically proven. And for those of you that want to go and do the research, go look up Dr. Warburg. Cancer cannot exist in the presence of oxygen, which is why we have hyperbaric oxygen chambers, and those are modalities used in the cancer, especially holistically. So when they took away one of my dad's lungs, now his oxygen capacity has decreased. And when you open the tumor and when you go in and you kind of poke the bear, for lack of a better term, typically, and I've seen this even when I did my internship, typically it always leads to a secondary cancer. I mean, there's a very, very high incidence of that. And I told him this, and of course he didn't listen. But then fast forward about 4 months later, he got diagnosed with a secondary cancer. So it was that sort of was very impactful for him, because what I had told him would happen did actually indeed come to happen. And I've seen this with other people in my family, primary cancer. I said, don't do the surgical procedure. And then 6 months later, secondary cancer in the same area. And of course, then the person. So my dad did the first one. The second one, just to tell you all about the way that it works. And there's so much of this which never comes to light. When they did I guess the same thing as it happened to you, Jeffrey, the scans, and they found out that he had the secondary cancer, they said, oh, we have to biopsy this to see if it's cancerous. And I went and I said, don't do the biopsy. Do not go down the same path that you went with the first cancer. But he said, no, let's just find out. So this individual, who ironically, just for you to know, was a urologist, decided to do the biopsy without anesthetic. So really, really hurt my dad. No anesthetic, and of course, no accountability. After the fact, I went and I said to him, I said, can we have some of the documentation that kind of outlines what you did? Because everything has to be like part of the electronic medical record. You have to sort of put down everything you do to your patient on his part of the protocols that's required by law. And he refused to give that to us because he knew that what he did was wrong. So there's a lot of that. So when you put your health in the hands of another and you don't know, I mean, people make mistakes. You do not want to be the one that's going to be on the receiving end of that mistake. So suffice it to say, my dad had, of course, like a whole slew of, as a result of that particular mistake, a whole slew of um, issues with being able to urinate properly. He had to be he had a catheter for a long time. It was just the quality of life decreases so greatly that it defies logic as to why you would go and do the things on your healing journey that actually go and take so much away from your quality of life, from your body's ability to function naturally in the way that it's supposed to. So if you go and you do a medical procedure and then you can't urinate, explain to me and make it make sense how what you did justifies the outcome. And a lot of times I find with people, especially in the cancer industry, that's never the case. And I talked at length for those of you that follow me on Instagram, and I'm going to be posting a whole bunch of stuff related, because most questions that I get are from women. Of course, it's relatable. I'm a woman, about reproductive system cancers, abnormalities, and issues. And the whole thing with HPV and cervical cancer is, I'm really passionate about that, because that is one area that absolutely defies logic and defies science. So please educate yourselves if you're going to make any kind of decisions, especially when you're going to undertake invasive procedures. Go and do the research. And the same for you. I applaud you for the fact that you want to take the holistic route, because if you do the research, you see that the number 3, I guess, killer of most people, especially in the United States, is medical errors, which is iatrogenic.
Exactly. Yeah, they had to make up a word for it, because if they say medical errors, that's going to really raise red flags. But you see it on a list, iatrogenesis. The average person is like, what the hell is that? Move on to the next. What's number 4? Wait a minute. So, and by the way, that could be error, but that could also be somebody taking their medication as prescribed. That could be no error made. That could be, this is the protocol, but this person wound up losing their life anyway, but did nothing wrong. Yeah, oh boy. And so the third leading cause of death is, all that stuff falls into that category, but we can't start to give more credit to the human body's ability to heal itself. When somebody discovers something that, oh, I got better and I didn't need treatment, I didn't need medication, it gets dismissed as, oh, that's just placebo. Well, just placebo, that means your mind just healed your body. That's remarkable. Let's do more of that. And we know that's real. And then on the flip side, because everything is about money and they're afraid of, any sort of taking me to court, any sort of issues there. So I have to tell you the worst case possible outcome, but we don't discuss the nocebo effect. So I'm in this paradigm right now. I'm terrified. You gave me a diagnosis that I don't know what to do. You're the expert that's supposed to save me. And you just painted this grim picture of even with your treatment, I could still die and the worst outcome could still happen. That plants that seed of nocebo, of that doubt in my mind. And now I believe something horrible is happening, and go figure, it happens. But we can't plant the seed of optimism. We can't plant the seed of, hey, this can get better on its own if you think it, if you believe it, and if your actions match that. That doesn't get discussed. And that's, again, I'm right there with you. The passion is there clearly. So much of this does, there's an aspect of it, I'd be lying if I said it didn't upset me, but I really do my best to take a deep breath, calm my body down, and not get angry, because getting angry isn't going to get anybody else to pay attention to anything other than my anger. Convey it in a calm way and give them the information necessary. Then, hey, they still might make the decision they were going to make, but at least now I've planted that seed, and that can start to make that difference. And I
This is why
really
it's
do.
important that stories like yours go out, because at least people can understand what they should or shouldn't employ. Clearly, when I had the stroke back in 2011, I didn't think of, if I'm going to be angry, that's actually very detrimental to my health, so I should stay calm. I just went into anger mode because these people were trying to harm me. So had I been more calm about it and just been like, thank you very much for trying to do what you're doing. However, I'm not interested and I'm going to go home. So it's important that this message goes out so that people can understand just how multifactorial health is and how multi-layered healing is. And just on that topic of, think of it like this, because I said this to many of the people that I work with, especially when it comes to cancer. When you get diagnosed with the flu or with anything that is very, like even diabetes, you never hear people being scared to death about these kind of diagnoses. But because the medical industry and the medical community has managed to brainwash people into believing that cancer equals death, because a lot of people die, but a lot of people die from the flu. Why do we not go into that state of fear that we would die if we get the flu that we do when we get the cancer diagnosis? It's equally as easy for you to heal yourself from one as from the other if you do what it takes. And I tell a lot of people, it's simple. It's not easy, but it's simple. It's so simple. And I know that I believe you had Dr. Hussey on, Dr.
Yes.
Stephen Hussey. Yes. So because I had him on my show and we talked about his experience because he had the heart attack. So I kind of resonated with that because it's obviously a cardiovascular heart disease related, like much like how my stroke was. And the things that he said he did and the changes that he experienced, just that alone, if people can take that and recognize how huge of an impact free, and I want to emphasize that, free things, which I've seen even you on your Instagram, when you do your grounding, when you do your cold plunging. And if you don't have a cold plunge, take a cold shower. It's equally as great. And those things that Mother Nature has given to us for free, if we implement just those things, we could take a big chunk of the healing and it's already addressed. And yet you have this medical community that makes you believe that you have to do X, Y, and Z. And people are so bought into this idea of trying to find answers. My dad was the same. And I kept saying to him, like, why do you need a biopsy? If they've already told you have a tumor, all of your energy should be like, okay, well, I have a tumor that I have to fix. If they're going to go and biopsy it, they're going to come and they're going to say, okay, it's cancer. You still have to go to I have to heal it. Like the direction in which you go, whether they do this or not, is the same, identical. And irrespective of whether it's stage 1 or stage 4, or they give it some other label to scare you into thinking that you need to do chemo and radiation and surgery, or just chemo or just radiation or just surgery, it doesn't matter. You still have to go down the path of healing, right? So concentrate all your efforts on that and put all of your attention. I mean, if you're going to get esoteric, or if you're going to go into the mindset aspect of it, there is that saying, what you feed will grow. So basically, if you want to feed healing, put all of your attention on that, put all of your energy on healing, and that's going to grow. Healing is going to grow. If you put your attention on the disease, well, that's going to grow just as easily. The universe does not have any kind of interest in preferential treatment towards one or the other. It's just going to let you choose. You have full say in it. So it's important. Here's an example based on what you said, the placebo and nocebo, because when my dad got diagnosed, I remember I was doing all the research, and of course I started studying it. And there was this one really cool story, and I told it to him. So there is this story where this guy goes, and his father has cancer, elderly man, and he goes and he finds this piece of wood on the ground on his walk when he finds out his dad had cancer. And he goes to his dad and he says that this piece of wood comes from a tree that's blessed. It comes from, and he said, this like really remote village where there are all of these monks that pray near this tree because it's so divine. And this man took this piece of wood and prayed with it every day and healed his cancer. So there is the power of the mind. If you take something and you believe in it, you give that the power. So imagine that you believe that this thing is going to heal you, and it did. And for those of you that don't know, I'm sure you know about her, Jeffrey, Anita Moorjani. Yeah, so she had stage 4. She was literally on her last breath.
Sure.
And she came back. She had tumors all over her body. She came back from that and is still alive to tell the story. And I have one thing that I always try to tell my patients, and I told my dad, for me, and this is exactly what I used, this was my secret when I was in the hospital after I had the stroke. If there's one person out there, one that has been able to defy everything that medicine has said to you, one person out of, like, let's say 8 billion, if one person healed what I, let's say, get diagnosed with, I will say, okay, so it's possible. And I will ride the train of possible to heal up until I heal that. So that is basically what I did when they were telling me, oh, you're a higher risk. You can have another stroke, and the second stroke always, like, we have data to show you the second stroke always kills. And I said, but are there people, and I asked them outright, are there people that healed? Are there people that got better and never had a second? Okay, because if that's the case, then I'll be that case too. But here you are, you're trying to tell me that so you're trying to, like, move my mind in the direction of a second so that becomes my dominant thought. And that's what people don't understand about the medical industry. And I'm not necessarily saying that everybody in the medical industry, because I know people that work in the medical industry and they're wonderful people. And I posted a lot of doctors on my Instagram that have actually been very outspoken and have talked against all of this whole BS that's out there in the medical industry that leads you to believe that cancer equals death or that this equals that. There are a lot of wonderful people in the medical industry and in the medical community that are actually trying to empower people. So you have to be very discerning. Find those people and work with them and get them to engage in your care plan in a way that it actually is conducive for you and it works for you. That's such an important aspect. Find the people that can step outside the box and work with you. And that's why I gravitate towards working with practitioners, because I know that they're way more open to it than doctors that have to follow the rules. If they want to keep their medical licenses, they absolutely have to. And if they speak against it, we all know Dr. Wakefield, he got stripped of his medical license. And there are many doctors that got stripped of their medical licenses and cannot practice medicine anymore. Here in Canada, we have Dr. Peterson. Those of you that know Dr. Jordan Peterson, who's like a world-renowned psychologist. He was a professor at the university that I attended. And I know that they are doing the same thing. He is coerced into taking some sort of education to be able to maintain his license. But at the end of the day, think of it like this. You could take a piece of paper away from someone, but the knowledge that's in their head and in their heart and the passion they have for that topic, nobody will ever be able to take that away from you. And the
They
same
can certainly
thing,
try.
yeah, well, of course they're going to try. But the same thing goes for everybody. If you have hope in your heart and in your head, and you have the fortitude and the strength of character to say, I do not care what you tell me, I'm going to do this one way or another, they can't take that away from you. So you have to keep your power to yourself to be able to go down that path, knowing that you are going to come to the finish line victorious.
100% right. Yeah. You mentioned Anita Moorjani. If anyone's interested, her book is called Dying to Be Me. phenomenal book, phenomenal story, phenomenal woman.
Absolutely.
And that was definitely one of the many stories that was at the forefront of my mind as I was going through my own journey. I don't even think about it in terms of I'm battling something. I continue to think of it. I was given a gift, and I'm not going to squander this gift. This gift is simply the opportunity to tell a story to share with people and empower people. And, in my scenario, I won't be the first. So to your point, I often think about the 4 Minute Mile, Roger Bannister. At some point, somebody was the first. And once it happened, now there's a whole bunch more that do it. And I shared that I recently had the opportunity to speak with Dean Hall. I don't know if you've heard of his story. Dean was diagnosed with lymphoma and leukemia, and he healed his leukemia from a swim in the Willamette River in Oregon, 187 miles that took him 3 weeks to do, and averaged 10 miles swimming per day in 40-degree water. And the swim essentially healed his leukemia, but he still had the lymphoma. And the lymphoma part, I mean, actually, both parts are just amazing, but he was told by doctors that nobody has healed from lymphoma. His attitude was, well, I'm going to find a way. My body healed from leukemia. I'm going to find a way to heal from the lymphoma. And he did that. It was just shy of a year, but he did forest bathing and he still
Yes.
does it to this day. He'll go out every Friday. He spends the entire day. He does 24 hours out in the forest, and he ends it with his plunge in the river, the running water, and just an amazing story. But here he was healing himself, allowing nature to heal him and just connecting himself again. And the doctors told him it can't happen, but it did. I mean, they can't even allow themselves to believe what's right in front of their face. They still say that it can't happen. But, he was the first one. So it's, whether to your point, somebody else has done it, so I now know it can be done, or there's enough people out there that just have that, they're wired in that way to say, I don't need somebody else to have done it before. I'm going to do it, and I will be the one to lead the way. And there's just more and more and more of us. I mean, you just think about what the human body is capable of. And if we get to a point where we can continue to share this information and understand what the body actually needs to optimize versus just surviving, we've
Yes.
seen people just survive, and that's why life expectancy in the States is mid-70s, mid to late 70s, because it's just surviving. Oh, something came up, and I guess it wasn't meant to be. Instead of 70 some odd years of just doing enough to get by and survive, if you learn at a younger age what the human body needs to thrive and to optimize. I don't want to go by standard of care blood work and say, okay, you're in a normal range. I don't want normal. Normal is very unhealthy right now in the States and really the world over. I want optimal, and I want to make sure that I get the information necessary for it and I apply it, and then I share it with other people without them feeling like they need to take on a second or third job to afford paying me to give it to them. This movement it's really powerful, and I'm really grateful to be a part of it. You mentioned Dr. Hussey. I mentioned Dean Hall. I've had Dr. Thomas Seeger. I won't go trying to list everybody because I don't want to offend anybody by not mentioning there. The number of people that I've invited on that get excited by my invitation and are so thrilled to just come share their story and share this information. This movement is so powerful, and to play a role with it's just so special to me to have my voice. And I truly believe this is, if not the entirety of, this is a massive piece of my purpose in my time here. And that's the reason I had my diagnosis. You mentioned having to put all your energy into that. I don't have a sense that I need to put so much energy into healing, yet I know deep down I do. So what I've recognized is there are some people, immediate family, very, very close friends, people that I felt out of love and compassion and respect to them, they needed to hear it face to face and we needed to discuss it. But some people, if their reaction is going to be to suck energy from you, even if it's unintentional, if their fear is going to be so overwhelming that as you share it with them, they're just going to pull from you and pull from you. My energy cannot go towards consoling somebody else for
That's
their
correct.
fear of my diagnosis. So and that hurts. I say that out loud because there's a couple of people that come to mind that I haven't had the conversation with. And I do hope that if they hear it from something like this, or they come across my podcast and me talking about it, I hope they know that it's as weird as it may sound, it's from a place of love. I don't want them to have a stress response to it because they're still in this state of fear. I want them to know that I'm good. I'm going to be fine. I'm optimizing my health and well-being. I'll pull from some of Dr. Zach Bush's work. He talks about cancer from a totally different perspective of
Yes.
many of us. I mean, there's a place of love. There's a place of recognizing that this is a group of cells that feel like life is coming to an end. So they're just grabbing on to hope to try to stay alive, and they're replicating and replicating. But that environment that creates that is something that we play a role in, whether we're aware of it or not. So, you mentioned about the emotional side of it before. And I know in my youth, I've always been a very sensitive, very emotional person, but I didn't learn how to cultivate that as a kid. I was a football player, numerous different sports, and you got to be a tough guy, you got to be macho. So my sensitive side couldn't come out. I would kind of just tell him to shut up and just go do my thing. But when you have those emotions inside and you don't allow them to come out, you just push them down and hide them somewhere.
Yeah.
You're creating in that environment that's conducive to tumors and cancers to thrive, because you're not being authentic, you're not being your true self, and you're not giving your body that opportunity to heal. So I was able to recognize that hey, this didn't happen to me. I played a very active role, albeit at that time I was ignorant to it, but I've done enough of that inner work since to be able to reflect back and say, oh wow, this is something I did. There's power there, and I had a recognition. I was sharing with a client of mine a few weeks back that I feel like I channeled this, but I told him, I don't feel this is my diagnosis. This diagnosis is for a previous version of me who has already died. In his wake is me, somebody who's living the lifestyle and applying the information that I've learned that my body on a cellular level needs to thrive and to optimize. In that, the rest of my body is going to look to that tumor and say, all right, buddy, we need you for some energy. We're going to ship you out. So that's the trajectory I'm on.
Yeah, so you speak to exactly um, what we were talking about earlier, how the the part of us that we repress, and I wholeheartedly believe this, and I said this about my dad, how he was very stoic and he kept everything inside. But we all know that everything is energy, and energy is never ever stagnated. It's never still, even in death. So this is one of the things that I learned when during my studies, that even in death there's movement. I mean, we all believe that, when you die it's still, but the decomposition of the body, there's movement in that. So when you take energy that is obviously always flowing and you try to suppress it, much like what you were talking about, how you were a sensitive individual, but you try to suppress all of that, that energy is going to eventually seek to express. And if you are going to keep it stuck in one place, it's going to try to bust out of that tissue. So it's going to grow, just like you said that Dr. Bush, and I love Dr. Bush. Dr. Bush explains that those tissues, even those, let's say, mutated, damaged cells, they are going to try to survive too. So that's why a lot of Dr. Andreas Moritz, who spoke about that in the past, and many, many other healers who talked about that cancer is actually a survival mechanism of the body. It's not a death sentence or a disease or an illness or something that's a terminal disease or terminal illness that we are led to believe by the medical industry. So oftentimes, if you look at it, of course, you have to go so much deeper into the thinking aspect of whatever you are afflicted with or by. If you look at it and you sort of dissect the whole thing, cancer, and back in the day, for those of you, here's a fun fact, you were able to detect whether you had cancer. Of course, they took this away because God forbid that you were able to diagnose yourself. You could actually detect cancer through pregnancy tests.
Yes.
Because if you really think about it, the way that pregnancy expresses and the way that tumors express are identical, right? Like when you get pregnant, obviously those cells start to replicate fast to be able to develop into a human, into a baby, into a fetus. Cancer does exactly the same. It just replicates out of control so that it can try to survive. And it looks for different fuel And I'm sure Dr. Seifert talked about this because that's his thing, and he's just such a brilliant man. It looks for different, and it will actually go out of its way to create. So cancer actually goes and creates pathways to get its fuel so that it can survive. So it's a survival mechanism. Because if you think about it, the way that the body operates, it actually puts a sheath over it, much like the pregnancy. Baby's inside the womb, and there's a placenta that, by the way, the organ, the placenta is the baby's organ, not ours. So if the body goes out of its way to protect the neighboring tissues by putting a sac over the tumor, it's actually trying to protect you. It's actually trying to make sure that you are not going to have that spread by and large in the neighboring tissues. So it's actually trying to really do the least amount of damage. And if you were to do what's necessary, you can actually get the body to do the work to break down that tumor and eliminate all of those components of the tumor very easily. I mean, it's so, so easy to do if you're willing to do the work. And I know that a lot of people, because I get a lot of messages and they say, well, then how do you explain metastasis and when cancer spreads? And I'll tell you, my dad was actually a perfect example of this. A lot of people go and try to get the medical. I know you're not doing this and I applaud you for it. They go to the medical community to address their issue, that being the cancer, the tumor, wherever it's at, while they continue with the same lifestyle that caused the cancer to begin with. So while you're trying to get rid of this on this side, you're bringing in extra on this side, and then it shows up elsewhere and you're wondering, well, how did the cancer spread? Well, it didn't actually spread, but it actually just created cancer in another part of the body. And if the body cannot keep up with the elimination of the toxicity that you keep bringing in, because all of its energy, like the immune system, is working so hard to deal with this primary one, it just doesn't have the resources to deal with the second, the third, the fourth. So now you're accumulating. And of course, think of what chemotherapy does. That alone, at the pH level of 2 at best, is going to create such toxicity. And it's very evidenced by the loss of hair. You don't have energy. It's just a detriment through and through. So if you're going to bring in chemicals while you're trying to get rid of this and you have a secondary and tertiary cancer, makes perfect sense. So yes, a lot of people don't understand, and I'm sure that you do, and please spread the message. I will do the same for people to understand. That's the only way we could, I think, even as a species, we could turn this corner in a way that it's going to put us on the path to healing, and understanding that it's multifactorial. And what you said about, be your authentic true self, express. Even it doesn't have to be in the presence of other people, but if you need to cry in the privacy of your own company. Cry to those that can actually listen to you. Don't ever expect anybody in the medical community to listen to you cry, because that's just not in their wheelhouse. But there are so many components to the healing, and they're all equally important, that don't leave any stone unturned. And if you need to work with somebody who's actually really trying to help you and can see the holistic person that you are. I know that in the medical community, they have specialists, much like they did for me, neurologists who deal strictly with the brain. But clearly, if, let's say, something travels through the cardiovascular system to get to the brain, it clearly speaks to the fact that it doesn't really have much to do with the brain, because there was something that traveled through the cardiovascular system. So you have to bring in the cardiovascular people. You have to look at it as a holistic approach, always and forever. And I think foundationally, there are so many factors. I kind of overarchingly have it down to 3. So there's the mindset that we discussed. Then there's the dietary, because everything we put in the body will obviously have an effect on the body. There's the mindset, the diet, and then there's the lifestyle. There are a lot of things that we could do to heal that are free. And I know that I see everything that you post on Instagram. You do your cold plunging, and you do your grounding, and you go for your walks in the forest, bathing that you just spoke about. Those are all lifestyle things. Smoking is a lifestyle factor that you have to eliminate. So if you work with somebody who understands healing and disease from a holistic perspective, they'd be able to guide you. And I know that you have that down pat. they'd be able to guide you on how you can actually walk that path towards healing by eliminating the factors that actually cause the disease to begin with.
Yeah, and there was definitely many of those things that I did in my youth, on top of the emotional side of things. So I look back and I see absolutely I played an active role in this. I went through years from 16 to 19. I was a smoker. I got up to a pack a day, which, I was raised around smokers, and my older brother opted, he never touched it. And I just happened to pick him up. That was kind of my thing, and just be rebellious in some capacity, and alcohol, which coming up January 8th will be 2 years that I have not had alcohol. Quite a few of these changes to my lifestyle that I made, thank you, that I made way before the diagnosis, which again, that just gives me the sense that I know I did play an active role in creating the environment within my body that allowed the tumor to grow. And I also know that I am now everything that comes up, even if it's, I've got 3 kids. My youngest is 5, and he's at a phenomenal stage right now where he loves to test daddy. He loves to do everything I tell him not to do and do it a dozen times in a row. And I try so hard to keep my cool with him, but inevitably I'll feel myself getting hotter and hotter, and then I'll end up yelling. And afterwards, thankfully I have that ability to recover back down quick, and me yelling isn't as bad as it used to be. But then I hold it to myself and I say, okay, hold on. He's there to test you. He doesn't know consciously that he's doing this, but
That's
he's
right.
testing you. This is one of the last stages that I know I need to work on and heal. It's not serving us. There's a point at which that side of the sympathetic nervous system, if it is truly to fight for my or my family's lives, I'll let that side of me come out. I'll let my inner Hulk come out. But boy, with him just running through the house or saying something inappropriate, I don't need to let that side out. So that is the current thing that I'm still working on that I know needs a little bit more work. But we are getting there. And you touched upon something massive there too. This movement of people that are still going the allopathic route. Yeah, I think it's still part of that disempowerment paradigm too. They're led to believe you didn't do anything. This happened to you. You didn't play a role in this. So there's nothing you need to do. You just come in to see us and we'll give you your treatment and we'll remove it surgically and then we'll do your chemo and radiation. You just keep living your life. And there's just such a disconnect there that I just pray, if nothing else, that's the message people get from this is, yes, every decision you make plays a vital role in your body's health and wellness or lack thereof. And instead of deferring to the expert, look in the mirror and recognize you're the expert. And if you don't feel qualified, great, time to do some work. The information's here and we can share it with you and dig a little deeper, but do that work. And I think that brings us to one of the last things I really want to ask you. And I'll try not to keep you for too long, but reading your book, there's something in the writing style that you had that spoke so deeply, it resonated so deeply with me. This dynamic of the 3 U's, your ego,
Yes.
your inner self, and your outer self. Since I was a little boy, I had a sense of that, but I never really sat with it. I never did any of that inner work. I know for sure that ego was the loudest thing. That was the part of me that made it a point. Hey, shut up that sensitive side. That's not supposed to come
That's
out.
right.
You're a tough guy. Go to the gym, go work out, go play football, go score a touchdown, all that type of stuff. And he was so dominant. And interestingly, to the point that there were kids that would use that word and say that I had an ego. And
Hmm.
I was so ignorant and living such an egocentric life that I would get so offended by that and defend myself and say, no, I don't. But boy, little did I know that was what was driving every decision I made because I was so afraid of people ridiculing me if they knew that other side, that inner me. So my outer me was so much driven by ego, and the inner me was silenced for so long. And the older I get and the more I've sat with that and done some work, I've really let inner me take the lead, and I've shown him love, and I've really, maybe I can say her, right? Because as you alluded to, that's more of the feminine side.
Yes.
And I've embraced that as I've gotten older, that I know there's a feminine quality to that emotional side, but that's not to get into the whole societal issue with gender and all that type of stuff. But we all have some balance of femininity and masculinity. Hey, listen, I'm a 5'9", 175-pound former football player, bodybuilder, all that type of stuff. So there's plenty of the masculinity that presents itself just by me sitting here and standing there. But to embrace and empower that feminine side, that inner me, it's really what's cultivated my healing, and it's what's allowed me to have conversations like this and put myself out there and tell the ego to sit back and be quiet and don't worry about what people are going to say. Just share what you can that'll help people. So
Yeah,
thank you.
and if you can find the balance, and of course you have to be so self-aware to be able to bring those in harmony, because certainly there's a place for, if when you read the story in my book, the ego played a massive role in even trying to keep me sort of away from fear, because a lot of times I kept thinking like, oh my god, people die in hospitals, and my ego's like, don't think like that. Like the ego was sort of so tough with me that I would not, like, the ego's like, we're not going to even entertain that idea, like, don't even. So I think it's important to know that if you can help, like, use your ego to create boundaries so that people don't overstep your boundaries. So it does take a lot of self-awareness and work to be able to bring those in harmony. And yes, of course, we have like feminine nature and masculine nature. I know a lot of men that are not, visually or physiologically big and strong by what society kind of has led us to believe, that are very masculine. I mean, I've walked into rooms where men who were not necessarily, like I said, big and tall and strong, and they just radiated this really strong masculine energy. They commanded respect in the room. And then there have been men who are tall, big, strong, and you could feel, especially if you're attuned to those kind of things and intuitive, you could feel their insecurities, their lack of self-confidence. A lot of that is very much energy based. Yes, I wanted to really touch on that in the book because I think it's so important that people know we have conversations in our heads. Even my kids, after I wrote the book, they're like, Mom, did you really have those? I'm like, yes, I did, every day. So, and I think it's important to know. So for me, spending the amount of time that I spent in the hospital after the stroke, it was such an invitation because I didn't have access to anything to distract me. So if you look at the silver lining in all negative things, it was such an invitation to really go inside and be able to kind of see all the things and deal with all the thoughts that were arising and dissect all the things that were coming up so that I can look at them from different angles and be able to understand them more in depth. And I think to a high degree, and everybody knows how I felt about the COVID thing because I was very vocal and I lost a lot of friends and people. I think that too was actually a great opportunity to be still. You didn't have to go and spend time at work running around trying to get to places on time and because your boss expected, and be able to really go. So if you do have this opportunity, much like what you said, Jeffrey, it's such a gift to be able to really slow down and take a look. It's an invitation for that. So look at the bright side and the positive side of things. Take a pause and dissect things. And what you said is such a great idea. Like, look at the way that Dr. Zach Bush looks at cancer as, so that you're not going to step into fear and sit there and let that run the show. Look at the way that your body works so that you can understand its different processes and its attempts at really. One of the things that I tell my patients every day, give thanks out loud. Like, your body's listening to you all the time. Give thanks to your body for everything it does. Every day I go through sort of like a scan and I say, thank you, brain, for everything that you do. I'm so grateful you healed. I love you so much. And then thank you, heart. Oh my God, I'm so grateful that you beat. And lungs, you guys are amazing. Thank you for all the oxygen. I know that that plays such a huge role. And kidneys, you guys are amazing. You filter out the blood. Like, I wouldn't be able to do anything without you. And then skin, thank you for keeping everything outside. And immune system, thank you for the work that you do. You're the army. I love you. It's so important that you integrate all of these things into your arsenal of healing. And of course, if you need guidance, work with someone. And I know a lot of people think that it's so expensive, and but people invest in things like expensive cars and purses and things of that nature when your greatest wealth is your health And don't look at it as working with somebody. Just go and work even on a short-term basis to educate yourself. Take all of that, take notes, have it, put it in somewhere where you can actually have access to it and ride with it. It's so easy to heal. It's stupid easy. Like if people can only know, and nature and the body provides everything necessary to healing. And I think the medical community is only needed for very acute things. Like if you get into a car accident and you need your life saved, I'm all for it. Absolutely. We love those doctors. We love the medical community that can actually step in and save your life. But by and large, for chronic diseases, many of which fall into that category, you could do all the work to heal yourself 100% of the time.
That's right. Yeah, and it's interesting you say it that way too. I think the money side of it. I mean, I think back. I've been in the fitness industry for over 20 years, and a number of people that would come up with the money excuse, yet that also tell me about, as you alluded to, whether it was the new car they got or the new purse they had, or
Yes.
worse yet, they spent $250 the previous weekend on a dinner out with drinks with their friends. I said, wait a minute, that's directly feeding. Now, listen, you can be out with friends, you can have a good time, I get it, but what they would tell me they were having and how late they were staying out, they're
Yep.
impacting their quality of sleep, they're not recovering right, they're drinking alcohol, they're eating garbage and dumping a ton of money into it. A lot of it is about just understanding what the body actually needs. And if you can allocate even just a little bit of funds to the right people, to your point, there's this movement, this empowerment side of it. If you let the practitioner you're going to work with know that, hey, money's tight, but I really want to do this, I'm certain they're going to work with you and say, okay, well, let's do a single visit. Let's start there and let's give you the tools that you need. This is going to really take you doing that much more work because we're only going to meet the one time. You have to put this stuff into action. But that's the key. If you're really ready, don't let money be the excuse. I mean, good Lord, the things that people will finance to be able to say, look at this
Yes.
new thing I got. They're putting vacations on credit. That's a very short window of time that even if you're gone for 2 weeks, you come back and now you're dealing with the reality you created for yourself. If instead, if you feel you need it, there's a case to be made. Financing the right education for healing your body is way wiser to spending your money on than time away or drinks or food or anything like that. So, I'm with you there. Working with the right professional is a great idea. Getting the tools is the bottom line, wherever you can get them from. Get yourself, invest into the credentials yourself. Be part of the
Yes.
team of empowering. I tell people all the time, money can't be the reason you don't get better. I'm so with you there. Dude, I'm really grateful for you. I'm grateful for your time. I'm grateful for your message. And I'm certain after listening to all this, people are going to be saying, wait a minute, how do I work with Simone? So how do people get a hold of you and how do they work with you?
Well, first and foremost, thank you so much. I mean, I'm so grateful that you're part of, Team Healers so that we can actually educate everybody about the importance of being their own healers and spreading the message of health in its true form, true health. So thank you so much for providing a platform for us to be able to spread the message about this and for, of course, for telling my story. I appreciate your support with the book as well. So, yes, I am reachable on Instagram. So it's just my name at Simone.Gisondi. I get a lot of DMs there. And of course, my website, SimoneGisondi.com, as well as I'm on all platforms, but predominantly those two. And my book is on Amazon Against Medical Advice.
Here,
Yes.
just so we know what
And
it
by the
looks like.
way, that is actually, I don't know if you were able to tell, but that's actually one of the visuals from one of my scans.
That's
So
amazing. I
that's,
thought so.
yeah, so that's actually my brain right there. You could see exactly where the stroke happened.
Well, thank God you heal. Thank God you're in a
Thank
position
you.
to help others heal themselves. I'm very grateful for your time. And listeners, if you made it through, which I'm sure you did, this story is worth listening to. Be sure to subscribe, like, comment, share, all that good stuff. And I'll be sure to put the info for contacting Simone in the show notes. And
Thank you.
until next time, thank you all.
Thank you all.